Greetings, health enthusiasts. Welcome to Healthy Lifestyle Tips, your trusted guide to a healthier life. Here we explore the various facets of well-being, from nutrition to exercise, mindfulness to rest, providing you with the knowledge and tools to live your healthiest life. Our goal is to empower you in making informed decisions and cultivating habits that promote optimal health and vitality. Today, we're unraveling the mystery of muscle knots. So prepare yourself for a riveting exploration into this common, yet often misunderstood health concern. Let's start with the basics. What exactly are muscle knots? Now, you've probably heard the term muscle knots thrown around in fitness circles or at the physiotherapist's office. But what does it actually mean? Well, muscle knots are essentially small bump-like areas of muscle that can be painful to touch. Picture a garden hose all tangled up. It's all twisted and knotted, right? That's what's happening in your muscles. These knots, or as the medical community refers to them, myofascial trigger points, are areas where the muscle fibers have tensed up and refused to let go. Sort of like a stubborn child refusing to leave a toy store. They are usually found in specific places in the body, often in the back, shoulders, and neck, though they can form in any muscle group. The term myofascial might sound complicated, but it's actually pretty straightforward. Myo means muscle, and fascial refers to the fascia, an extensive network of connective tissue that surrounds and penetrates every muscle, bone, nerve, artery, and vein, as well as our internal organs, including the heart, lungs, and spinal cord. These myofascial trigger points can be quite bothersome. They can cause localized pain when touched, and sometimes they can even cause referred pain. Which means you might feel the discomfort in a different area than where the knot is located. But why do these knots form in the first place? Well, there are several reasons which we'll explore later in the video. For now, it's enough to know that they can be caused by factors like poor posture, stress, overuse of muscles, or even a sedentary lifestyle. So now that we've untangled the basics of muscle knots, you should have a better understanding of what they are. They're not just lumps of discomfort but complex physiological phenomena that can have a considerable impact on our day-to-day lives. Understanding what muscle knots are helps in identifying them and seeking appropriate treatment. So let's move on to learn more about what causes these knots and how we can deal with them effectively. Now that we know what muscle knots are, it's important to understand what causes them. Muscle knots, medically known as myofascial trigger points, are usually the result of several factors. One of the most common is stress and tension. When we are stressed, our bodies respond by tightening our muscles, especially those in the neck, shoulders, and back. This constant muscle tension can lead to the formation of knots. Poor posture is another significant factor. Many of us spend hours each day hunched over computers or looking down at our phones. This unnatural positioning strains our muscles, leading to imbalances and knots over time. In addition to this, prolonged sitting or standing, especially in an uncomfortable or unnatural position, can put unnecessary stress on our muscles. This is often the case with office workers or professionals who stand for long periods like shifts or surgeons. Injuries can also lead to muscle knots. When a muscle is injured, it often goes into a protective mode, contracting to prevent further damage. This contraction can result in a knot, if not properly managed. Lastly, dehydration plays a role. Water is essential for healthy muscle function. Without it, muscles can become tense and more prone to knotting. So in brief, our lifestyle habits, including our work environments, physical activities, and even how we handle stress, can lead to the formation of muscle knots. But remember, everyone is unique. What causes muscle knots in one person might not cause them in another. It's all about understanding your body and recognizing what might be contributing to your discomfort. Identifying these causes is not just about finding blame. It's about understanding how we can change our habits and behaviors to help prevent these knots from forming in the first place. Identifying the cause of your muscle knots can be the first step towards effective treatment. And the good news is, once we know the cause, we can take steps to address it. Muscle knots can cause more than just discomfort. Let's look at some of the symptoms and effects. Firstly, localized pain is a common symptom of muscle knots. This is a kind of pain that is confined to a specific area in your body, usually where the knot is located. It can feel like a consistent, dull ache or a sharp, intense pain when the knot is pressed or when the muscle is in use. This pain can be quite bothersome and sometimes even disrupt your daily activities. Another symptom is reduced flexibility and range of motion. Muscle knots can tighten and stiffen the muscles, making it harder to move the affected area. This can limit your ability to perform certain movements, like reaching for an object on a high shelf or bending down to tie your shoes. In severe cases, it can even make simple tasks like walking or lifting objects challenging. Muscle weakness is another potential effect of muscle knots. When a muscle is knotted, it's not functioning at its full capacity. This can lead to a decrease in strength and endurance, making physical activities more difficult. If you're an athlete or someone who enjoys working out, muscle knots could significantly affect your performance and progress. Lastly, let's talk about referred pain. This is pain that is felt in a location other than where the actual source of the pain is. For instance, a knot in your neck might cause you to feel pain in your head, leading to frequent headaches, or a knot in your back might lead to pain down your leg. This happens because the nerves around the muscle knot can become irritated, sending pain signals to other parts of your body. So to sum it up, the symptoms and effects of muscle knots include localized pain, reduced flexibility and range of motion, muscle weakness, and referred pain. These symptoms can affect your physical performance, your comfort, and even your quality of life. If you are experiencing any of these symptoms, you might have muscle knots. So you've identified a muscle knot. What's next? How do you treat and prevent them? The good news is there's a wide range of solutions to tackle these pesky muscle knots. Let's dive right into it. Firstly, regular exercise is key. Keeping your muscles active and flexible helps prevent the formation of muscle knots. Try to incorporate a variety of exercises into your routine, focusing on strength training, cardio, and flexibility. Yoga and Pilates are excellent choices for promoting muscle flexibility and relieving tension. Next up is hydration. Staying well hydrated is not just good for your overall health, but it's particularly beneficial for your muscles. Water helps keep your muscles elastic and lubricated, reducing the likelihood of knots forming. So make sure to sip on that water bottle throughout the day. Now, let's talk about posture. Maintaining good posture, whether you're sitting, standing, or even sleeping, can significantly reduce muscle strain and tension. It's all about alignment. When your body is properly aligned, your muscles can function as they should without unnecessary stress or strain. Massage therapy is another effective treatment for muscle knots. A trained massage therapist can apply pressure to the knot, helping to release the tension. But if a professional massage isn't in your cards, don't fret. Self-massage techniques like using a foam roller or a tennis ball can also do wonders in relieving muscle knots. Heat or cold therapy can also be beneficial. Heat helps to increase blood flow and relax the muscles, while cold can reduce inflammation and numb the pain. You can experiment with both to see what works best for you. Lastly, if your muscle knots persist despite trying these methods, it might be time to seek medical help. A physical therapist or a doctor can provide further treatment options and advice. But don't forget, prevention is just as important as treatment. Keep your muscles active, stay hydrated, maintain good posture, and listen to your body. If you feel a knot forming, take action early. A muscle knot might feel like a small issue, but it can impact your overall muscle health and quality of life. So take care of your muscles and they'll take care of you. Remember, prevention is always better than cure. Take steps to prevent muscle knots and maintain your overall muscle health. So there you have it. A comprehensive guide to understanding, treating and preventing muscle knots. We've delved into the depths of these pesky little tight spots that often cause us discomfort. We've explored what they are: essentially tense muscle fibers that have not been able to release their contraction. We've uncovered the various causes, from poor posture to overuse during strenuous exercise and even stress. We've discussed their symptoms, which can range from dull aches to sharper pains. And most importantly, we've shared valuable insights into how you can treat and prevent them, from stretching and massages to maintaining a healthy lifestyle. There are numerous ways to keep muscle knots at bay. Thank you for joining us on this journey to better health. Don't forget to subscribe to Healthy Lifestyle Tips for more insightful content. Remember, your health is your wealth. Until next time, stay healthy.